Tracheostomies and Dysphagia by Amanda Dubois. What is dysphagia? Dysphagia is simply difficulty swallowing because food or liquid is not going down correctly. This could cause people to change the way they eat in some way, big or small, that could include eating or drinking slowly, eating or only soft foods, eating or drinking less, avoiding social situations such as weddings, where eating is involved. This could cause weight loss or dehydration. Choking is a major sign of dysphagia. A globus sensation, like something is stuck in your throat. What is a tracheostomy? The tracheostomy is a medical procedure that we may see as SLPs that involves a hole that is cut through the neck. And this tube, this cannula, is put into the stoma, the hole, and it allows air to come up from the lungs into the lungs. And so the nose and the mouth is bypassed. So this is the only source of air. You can see that this is cuffed. And so if a patient has a tracheostomy, we need to be careful to make sure nothing covers their tracheostomy when we're treating them, as this is now how they get oxygen. What causes dysphagia in patients with tracheostomies? The tube in the trachea reduces the movement of the larynx a little bit during a swallow and can make swallowing more difficult as our larynx moves up and out when we swallow. We don't need to be afraid to treat or evaluate the swallow function of these patients with tracheostomies as long as we're using evidence-based practice and we know what we're doing. These patients still need to be treated, and there's been some studies shown that some SLPs will turn these patients away. What is decannulation? It's just when we take out the cannula, which is the tube in the tracheostomy. It is the ultimate goal of the rehabilitation process, but it's just not always what can be done. We're just going to do whatever is best for the patient. If they need the tracheostomy to maintain their oxygen levels, then they're going to keep it until they don't need it. One study showed that the decannulation of a tracheostomy did not actually improve swallow, but it did greatly improve voluntary cough function. Long-term ventilation using tracheostomy is more common now, as it's just easier, but patients who can be decannulated safely should be, as this raises their survival rate. Will patients with tracheostomies always have dysphagia? Patients with tracheostomies may or may not have swallowing problems depending on other comorbidities that they have. Just because they have a tracheostomy does not mean they're going to have dysphagia. If the patient has mechanical ventilation through the tracheostomy, they're higher risk for dysphagia with aspiration, and that's just because they need suction because mucus collects around the tube in the trachea, and this is already below the level of the vocal folds. So mucus here is already actually aspiration. So if that would get in the lungs, that would not be good. And that is it. Thank you for listening. Here are my references. Thank you very much.